I'm going to talk a little bit about bisphosphonates in dentistry and what those mean for dentistry and what you need to know as a patient. If you've ever been put on a drug like denosumab or Fosamax or Prolia or Xgeva, any of these bone altering drugs, you need to make sure you let your dentist know. Let us know when you come in for your appointment, because they have some pretty serious implications for dentistry. The main issue that we run into with these anti-resorptive drugs is that they can prevent bone healing, meaning that if you have a procedure done like an extraction or even a root canal, and in some cases maybe even a deep cleaning, patients can experience non-healing. And what that means is, let's say we pull a tooth, that leaves a hole in the bone, right? Well, that hole in the bone may not fill in like ever if you've been on these medications for an extended period of time. The good news is that the risk is actually relatively low in the literature. You know, some reports say it's 1%, some say it's up to maybe 3 or 4% that actually experience these kind of sequelae after they've had a tooth extraction and they've been on these drugs. But it really is dependent on how long you've been on the drugs and how high the dose was. For example, patients that have been on IV infusions tend to be at a much higher risk, and that's because the dosages are just higher. One thing to be aware of with any of these anti-resorptive drugs, most of which are bisphosphonate medications, is the medication stays in your system for up to actually more than 7 years, but the half-life is 7 years for these drugs. So that means that if you stopped taking the medication today, in 7 years from now, there's still half of that drug active and available in your bone. And the way these medications work is they block the osteoclasts. They actually deactivate them. And osteoclasts, as you probably know, are cells in your bone that break down bone in order to allow the bone to remodel. Because in order for bone to heal itself or repair, it has to break down old bone to build up new bone. And so when you get a tooth extracted, in order for the bone to remodel and fill in that hole, you have to have your osteoclasts active. But when you're taking these bisphosphonate drugs, it does deactivate those cells. And so that's why you can get this condition called osteonecrosis of the jaw. And management of this condition, if it does occur, usually requires referral to an oral surgeon. We have a couple of good oral surgeons that we work with here in town, but honestly, the best thing to do is to prevent this from happening in the first place. And so I always just try to have a frank conversation with patients that have been on these medications and say, hey, you're at some kind of a risk here. Let's see what we can do to try to mitigate that risk. Now, there was a white paper that came out several years ago, and one of the recommendations for patients who've been on this medication is to take a drug holiday. That means that you would stop taking the drug for maybe 6 months or even a year to let some of it kind of flush out of your system, let the levels drop a little bit. Obviously, as I mentioned, because the half-life is so long of this drug, it's not going to be completely out of your system, but it will mitigate some of the risk. And it's something that you might want to discuss with your doctor and also with the oral surgeon who's managing your case. So definitely something to let your dentist know if you had any of those medications in the past. Usually they're prescribed if you have osteoporosis or osteopenia, or if you have some type of cancer that your oncologist is concerned may spread to your bone, because the medication will slow down the turnover of the bone and prevent the cancer from spreading to the bone is the idea. So be looking out for that if you have any of those conditions. And I hope this video has been a little bit helpful, and don't hesitate to give our office a call or reach out if you have any other questions. Thanks so much. We'll see you soon.